Hello everyone, welcome to IVMED webinars. Today, this is a series of educational webinars of fertility specialists at IVMED Family Medical Center and specialists of IVMED Family Agency. My name is Irina Doroshenko. I am medical coordinator of IVMED Family Agency at IVMED Clinic. And today's topic of our webinar is egg donation programs at IVMED Medical Center, suitable individual options, services, and your benefits. I want to introduce you our speakers today. It's Nadiia Melenevska, Ph.D. in biology, head of international department and customer sourcing at Medical Center IVMED, director at IVMED Family IVF&surrogacy agency. Also, Dr. Veronika Ulanova, MD, obstetrician-gynecologist, fertility specialist, doctor of the highest category and co-founder of Medical Center IVMED, and Olha Chaplia, Ph.D., senior embryologist at IVMED IVF Laboratory, ESHRE certified senior embryologist, 11 years of IVF and genetics laboratories practice, and she is in 2019 got European certification as a senior specialist. Today, we will have issue that we discuss. It will be types of egg donation programs at IVMED, services included in our programs, suitable options and benefits, which choice is better in my case, the differences in options provided by different IVMED programs. I also want to remind you that we have our general chat, so please feel free to ask any questions to our specialists. After presentation, I will read them and we will discuss. Also, I want to introduce our medical coordinator, Nadiia Melenevska. She will help with translation of your questions. So let's start. Nadiia, please.
Okay, hello. I want in general to tell you a few words regarding these egg donation programs from Medical Center IVMED. Why there was a decision to make these programs? For many years, we have studied the interest and the needs of our patients, and we now understand profoundly what they actually need when they are seeking for treatment with egg donation. We would like to start with our range of programs. The first program that I want to introduce you, that is a program of which will help you to save your budget. For example, you have tried a lot of IVF attempts and you have spent money because the treatment is quite expensive, and you at the moment may be limited of budget, but you still want to try. And you want to have embryos for transfer. We can offer you the special program, which includes the usage of frozen donated egg cells. What is the specific of this program? As you maybe from our previous webinars, you have heard from our main embryologist, head embryologist, Birol Aydin, that in Medical Center IVMED, you have an opportunity to have a program with frozen egg cells. Usually it is not so simple because you can successfully frozen embryos and have a very good outcome after sewing, but freezing of egg cells is quite difficult, and this technology needs not only technical devices or some methods, but also there should be very high-skilled embryologists and specialists who can really perform this vitrification, freezing of oocytes. At Medical Center IVMED, we perform very successfully sewing, freezing and sewing of oocytes, and the rate of sewing of this oocytes about 85–95%. So you can see that it is quite high, and it is very good probability for you to try to use these frozen oocytes for your treatment. For example, in this program, economy frozen egg donation program, the price for this program is not so high, 2,650 euro. And this program will help you to get embryos for your embryo transfer attempt. In this program, we include not less than 6 frozen oocytes. We think that is quite good chance. Also, you can use the opportunity of fresh or frozen embryo transfer. That will be convenient for you. It is included in package. And also, you will be supplied with medicines for maintaining your pregnancy during 2 weeks. Because as we understand, sometimes in European countries, it is a problem to purchase the set of medicines for hormonal medicines without recipe, and patients experience some difficulties because they have to go to visit their doctors and ask for this prescription, etc. It takes time, it takes money. We propose you within this package the set of hormonal medications, so you completely supplied with this package. Also, for your convenience, we developed a special description for this program, for each program actually. If you will need more detailed description with some payment plans, etc., you can contact us and we will send you details. In general, this program doesn't require any special sperm indexes, so any sperm quality can be used for this program. The success rate in this program, we achieve about 85%, but of course it depends of the state of your endometrium. In case of good endometrium state, you can achieve this result. What we also can predict that we promise that here can be one blastocyte for embryo transfer. That is not a guaranteed program, but still you can estimate your chances using this statistic. Regarding care and convenience. Care and convenience, we developed also special conditions for you. You can have accommodation within this package in apartment or hotel. We developed for you convenient schedules. So, for example, you can come 1 time or you can come 2 times in program. You can stay 1 time for 5 days, and you can do everything that should be done within this program. I mean, in relation of medical procedures. Or you can come a few times. You can get, for example, medicines, and then come back when the embryos are ready and make embryo transfer. On practice, it is very convenient and our patients prefer to do this way. What to do if, for example, you have low AMH, anti-Mullerian hormone level, and you want to try your own stimulation, but still that is a very good option if you will fail in your stimulation cycle. You will have a chance to transfer embryos created with a donor egg cell. It is again quite profitable offer because you will have anyway the chance to become pregnant. This program is called two-component program with own IVF cycle and frozen egg donation. What is interesting in this program? So you can start your stimulation within this program, your hormonal stimulation. We will collect eggs. We will perform fertilization. We will freeze the embryos. In parallel, we will use donated egg cells. The number of egg cells, the number of egg cells is not less than 8. This is also a good chance. So before embryo transfer, you will have your embryos and you will have embryos created with donor egg cells. Okay, if your embryo transfer will fail, implantation will fail, anyway, you have a good chance to transfer another embryos and as a result become pregnant. So for your convenience, we again include fresh or frozen embryo transfer. It's up to you. Please choose any convenient for you plan. And we also will supply you with a set of hormonal medications. So again, up to the test, pregnancy test performed with ultrasound diagnostic, you can maintain pregnancy with required hormones. The price for this program is €6,100. So what is Statistic in such program? Here we can say that we can get at least one blastocyst for embryo transfer under condition of low sperm quality. So it means that if your sperm quality is normal, you can get even 5-6 blastocysts. For this program, we do not have any special sperm requirements, and the success rate for this program under condition again of normal endometrium state is 85%. How to choose how to choose egg donor? In any program, you can use our IVMED Cryobank. This Cryobank contains a lot of profiles. You can search within these profiles and find the features of egg donor that suits you the best. The profiles also contain the adult photo of egg donor. As you know, in Ukraine, the egg donation is anonymous. We are not able to provide you personal information, name and address or this special data, but you can choose, for example, different features like color of the eye, color of the hair, height, weight, some hobbies, some skills, education. So you can get all this information and then confirm to our coordinators your choice. After that, we will plan when your egg donor, for example, will start stimulation. In frozen cycles, of course, you can search and find any candidate. If we have frozen egg cells of this egg donor, you can start immediately. It depends only on your menstrual cycle when you will start preparation. So again, we propose the accommodation in this program. I should tell you that we propose accommodation in any program. So this option makes these programs very comfortable. If, for example, your age is older than 35 years, you're recommended to do Ph.D. testing to avoid chromosomal abnormalities, or maybe you want to select the gender of your future child. You can try mostly the same option. You can do your own stimulation because you still want to try your to have your genetically related child, but again, you want to have an option in a case if it fails, you will use embryos made with egg donor cells and transfer them next to the own embryos. So we developed a program which is called Advanced Two-Component Program with own IVF cycle, frozen egg donation, and PGD5, 5 chromosomes. What is the option of this PGD5 testing? It will give you a chance to check these 5 common abnormalities. 4 common abnormalities, and the gender of the child, because it checks X and Y chromosomes. So in this program, you will do the same. There will be your stimulation, ovarian stimulation, and we will get your egg cells, we will fertilize them, we will freeze the embryos, and simultaneously we will fertilize the eggs of donor. The number of eggs will be not less than 8. But additionally to these procedures, we will perform PGD testing for all these embryos. We formed very good price for this package. It is 6,850 euro. We think that is very interesting price for those who can do such complex package. Again, talking about Statistic in such program, you can get 1 blastocyst for embryo transfer, even under low sperm quality, and you should understand that PGD testing may decrease a little bit the outcome in cycle after testing. Because if there are some abnormalities, these embryos are not recommended for transfer, so we indicate a maximum 3-4 blastocysts after PGD testing. And in case if the state of endometrium and hormonal state are normal, the success rate in such program may be about 85%. Again, there is no special sperm requirements and very convenient schedule for your stay. You can travel 1 or 3 times. It depends how you plan to get medication set. You can see, for example, arrival to start ovarian stimulation and embryo transfer on 5th day after fertilization. So, and 3 times, of course, you can come for sperm freezing. Then you can get, for example, medications. You can start your stimulation at home. You can come on 7th, 8th day on your stimulation and finish it here. And we will make fertilization of your cells, egg donor cells, and then we can perform a transfer, or you can come again in some time taking medicines, preparing for separate transfer. We have also the same program, but with option with PGD-24. So again, if you want to be sure that the embryos that you transfer of a very high quality, and just you won't be sure that you can avoid the risk of miscarriage, and to raise the implantation success rate. So you can choose the same program with own stimulation, with simultaneous egg donor fertilization, and just use the option of PGD-24 testing. The price of this program will be €7,000. So the success rate in this program under normal endometrium and hormonal state is about 85%. Also the statistic that at least 1 blastocyst for embryo transfer under condition of normal sperm quality and normal chromosomal status. Maximum you can get 5-6 blastocysts. You just should take into account that the PGD testing 24 chromosomes takes up to 4 weeks. So the plan of your stay should also include this time gap. That is the kind of very interesting type of programs that is a money-back guarantee of embryo transfer. So we have an option. Here I will show you the guarantee program for 1 embryo transfer, but we have also for 2 embryo transfers. We can send you this program. So what is the main idea of this program? We declare that we will use not less than 8 donors oocytes in this program, and you will receive at least 1 blastocyst. You can see it here. At least 1 blastocyst, or in opposite way, we will pay you money back. So again, this program, also for your convenience, includes fresh or frozen embryo transfer, the set of medications for 2 weeks. So the price of this program is €4,850. Just talking about all these programs, I want to pay your attention that any program no matter the egg donation, own stimulation, surrogacy, includes the services of agency, clinic agencies. So we will meet you at the airport. We will arrange you transport from your place of your stay to clinic, from airport to clinic, and from apartment to airport when you will back home. You will have personal coordinator who will accompany you during the whole process and will answer all your questions, help you with the schedule, will control the taking of the medicines, changing of the protocol, modification of the protocol, etc. And again, accommodation is also included in this program. But if you want to have a guarantee of being pregnant, again, we can offer you this option and also offer you money back guarantee within this program. And what is the specific of this program? So we guarantee you that we will perform 5 attempts of embryo transfers and you will be pregnant. When the guarantee conditions will finish, the guarantee conditions will finish on 12th week of pregnancy. So you can be sure that if something happened during this 12 weeks, we will restart the program. We will make transfers, but we guarantee that after 5 attempts of embryo transfer, you will be pregnant. The price of this program is 11,500 euro. You can see that mainly all options are unlimited in these programs. What is the success rate of this program? Pregnancy mainly detected from second, third attempt under condition of normal quality of patient's endometrium and hormonal status. And again, under these conditions, success rate is 98%. But you should take into account that guaranteed programs, they require the check of sperm quality. It is very important. So we will ask from you the set of next examinations. Again, besides the infection tests, we will ask from you spermogram and DNA fragmentation test. Also, we will ask karyotype testing. We understand that maybe in your country there can be a problem because, again, you will need a prescription to perform this testing from your doctor. You can do it in our clinic. You can come for first visit when you will sign agreement, when you will provide, your partner will provide a sperm sample. We can perform karyotype testing for you, but you should understand that we can confirm that you can participate in this program only after 4 weeks, when the test result will come. Again, accommodation in this program for all attempts, for all 5 attempts, are included in this program. And now I want to introduce you the programs. Again, you could hear about them from our embryologist, from Veronika Ulanova, or maybe you have heard some webinars that he hold. That is some kind of recharging of potential of your egg cells. That is a modern technology of transfer of spindle or mitochondria. Maternal spindle transfer program. What does it mean? It means that we can stimulate the patient, we can obtain egg cells, and we can get from these egg cells a spindle and transfer it to egg donor cell. After that, we get in this cell, egg donor cell, the genetic material of patient. So that is a good chance to get your own child genetically related to you. This method a little bit complicated and more complicated than the next one that I will tell you about, mitochondrial transfer. So the price of this program is 14,000 euro, and it includes the set of hormonal medications as in each program for your convenience. The success rate in this program is more than 38%. Again, a lot of success depends on the state of your endometrium. So before starting this program, you should be sure that all conditions are appropriate for embryo transfer. There is no special requirements for sperm. Accommodation also included in this program. Mitochondrial donation program. The transfer of mitochondria again can make the potential of the cell, own patient cell, much higher. So in this method, we transfer mitochondria from egg cell to patient egg cell. In this program, you can see the mitochondrial donation. One cycle is included. Also the set of medications, and the program total price is 6,350 euro. The success rate is 36%, and again, no special requirements for sperm cells. The program includes 5 days of accommodation. And that is a final option, but quite powerful. In case if you experience insufficient outcome in blastocyst culture, there is a very good option to use pro-nuclear transfer technology. In this case, you get a good chance to be pregnant with your genetically related child. This program includes the stimulation of the patient, and also the stimulation of egg donor. We fertilize the cells of patient with partner sperm and freeze without cultivation. And we do the same with egg donor cells. Again, we fertilize them with patient sperm and freeze. So you can then you can embryologist can perform prenuclear transfer. They transfer prenucleus to embryo made with egg donor cell, and it is not actually embryo still, it is fertilized egg cell. And after that, this egg cell receives genetic material of the patient, and the embryo which will develop will be genetically related to the patient. In this program, we will have one cycle of prenuclear transfer, and here will be the set of hormonal medications included for patient endometrium preparation and maintaining of pregnancy for 12 days. Up to the ultrasound test of pregnancy. The price of this program is 13,000 euro. This is, we think that is out-of-date technology, and it brings the result even in quite poor quality cells, more than 38%. Again, no special requirements for sperm, and this program includes accommodation. That is all regarding our egg donation programs. Thank you for your attention, and you are welcome with your questions.
Thank you, Nadiia, for such informative presentation. I saw that participants of our webinar also interested in and ask a lot of questions. So I will start with the first, and the first question will be to you. Can I and my husband sign contract remotely with your agency?
Thank you for question. Yes, it depends which type of program are you interested in. If we talk about egg donation program, yes, you can start your program remotely. We will stimulate a donor for you, and you can send us your biomaterial with couriers, and we can perform embryos, freeze them, and they will wait for you up to the time when you will come and make embryo transfer. If we talk about surrogacy program, the same situation. Yes, we can sign contracts. You can ship your sperm, for example, to our clinic, and then we will start a program, and you will have just to send us the set of documents. We can send you information personally about that.
Okay, and the second one, I think also to you, if I want to have additional specific info about my egg donor, can you send it to me?
It depends which specific information you want to have. Again, as I told previously, if that is not personal data regarding the name, address, all other information we can send you. For example, if you have interest, what is the hobby, exact hobby of this egg donor, or maybe you want to know something about their relatives or just in general. Sure, individually we can do that for you, just according to your request.
Okay, thank you. The third one will be to Dr. Veronika. I had several embryo transfers, but I didn't get pregnant. Do you have special technique for embryo transfer that will help to get pregnant? Nadiia, please help us with translation.
Здравствуйте, вопрос к доктору Веронике. У меня было несколько переносов, но не получилось забеременеть. Существует ли специальная технология для переноса эмбрионов, которая помогла бы мне забеременеть?
Спасибо за вопрос. У себя в клинике мы используем такие методики, которые могут повышать вероятность имплантации. К ним относятся введение в полость матки неипогена. Также в полость матки возможно в день переноса вводить хорионический гонадотропин на определенном разведении, либо вводить в полость матки PRP, методика так называемая, то есть плазму свою собственную, обогащенную тромбоцитами.
In our clinic, we have several options and several techniques that can be used to increase your chances of getting pregnant. The doctor has just listed 3 of the possible solutions to your issue, which is the first one is to introduce the diluted chorionic gonadotropin into the uterus cavity. This would help. Second option is to use the Nicogen, also to insert it into the uterus. And the third one is to use PRP, which is the your own plasma with additional thrombocytes, which helps in this case.
Но перед тем, как обсуждать подобные методики, нужно понять, какого качества вам переносились эмбрионы, были ли вы обследованы между неудачными протоколами ЭКО на предмет факторов, которые могут также снижать вероятность наступления беременности. Если нет, это дообследование может повысить вероятность наступления беременности без применения дополнительных методик.
However, before you're ready to use such techniques, it is best to check if other factors failure of pregnancy. It could be the quality of the embryos. So if they were not tested with Ph.D, it's worth doing that. If you haven't been examined before having a transfer, then we should also examine you to exclude the possibility of infertility due to reasons of the health of the woman.
Спасибо за вопрос.
Thanks a lot for your question.
Okay, but the next one is also to you. I'm 42 years old. I had 5 IVF attempts. My own eggs I had transferred, but with no result. At my age, is it possible to try one more stimulation or just better to use donor eggs? Thank you.
Добрый день, вопрос снова к врачу. Мне 42 года, у меня было 5 попыток ЭКО на моих собственных клетках. У меня был перенос, но безрезультатный. В моем возрасте возможно ли попробовать еще раз стимуляцию или лучше перейти на донорские клетки?
Для того, чтобы однозначно ответить на этот вопрос, надо иметь больше информации.
In order to answer this question clearly, we would like to have more information.
А именно, надо понимать уровень антимюллеровского гормона, то есть состояние яичников, их резерв, запас.
One of the most important factors is the state of the ovaries, the ovarian reserve, and for this we need to know the AMH levels.
Если яичниковый резерв достаточный, можно обсуждать собственную стимуляцию, которая позволит получить достаточное количество клеток, соответственно, получить выборку по эмбрионам, которая будет необходимо обязательно подвергнуть процедуре генетической диагностики, так как в возрасте после 40 лет вероятность хромосомных поломок в яйцеклетках существенно повышается.
If AMH levels allow it, it is possible to run another stimulation and to receive the enough quality of the oocytes. However, it is recommended to do the Ph.D genetic testing before the transfer because after the age of 40, 41, the quality of the cells decreases dramatically.
Если при этом антимюллеровский гормон снижен, вероятность получить достаточное количество клеток, при этом при культивировании получить бластоцисту правильную генетически, к сожалению, не очень высокая в возрасте после 40 лет, тогда лучше рассматривать варианты донационных программ.
If the levels of the AMH are quite low, then the possibility of obtaining enough quality of good oocytes and of cultivating good embryos up to the blastocyst stage is quite low. And in this case, the doctor would recommend to use egg donation.
Либо, как альтернативный вариант, можно рассматривать программу накопления oocytов для того, чтобы собрать необходимое количество, которое позволит получить правильный генетический эмбрион и говорить о его переносе. Спасибо за вопрос.
A good alternative would be to accumulate egg cells due to various stimulations until you receive a sufficient quality of the oocytes, and then to cultivate, to try to fertilize them and cultivate and to receive the healthy, genetically correct embryo. And then we could discuss the transfer of this embryo into the uterus. Thank you.
Okay, thank you. I saw that the next question, I think, will be to Olha Chaplia, our embryologist. Do you have time-lapse technology? Does it increase chances for pregnancy? How it works?
Hello, thank you for your question. Yes, we have a so-called time-lapse technique. You may also heard about as an embryoscopy. And this is a very novel approach that helps to assess embryo quality without even taking embryos from the incubator. So it's basically a big incubator that is already equipped with a special camera that makes photos of embryo within 15 minutes. And by the end of the culture, like in 5 days, you can assess the whole development of the embryo with a special movie. So embryo is like superstar in such case, and embryologist actually gets the possibility to see all these steps that we actually miss during standard culture, and that gives us much more information about embryo development issues. Talking about the possibility of pregnancy occurrence with time-lapse technology, yes, it basically increases it a bit. Why? Because we do not disturb embryo. It stays in the incubator the whole time of its culture till we do transfer or freeze it. But basically, it's a selection technique as well as PGT, because it helps us to select the most potent embryos that develop steadily within special time limits and basically have more chance to implant into uterus. So to be clear, yes, time-lapse technology is there in our laboratory, and it may help you to get pregnancy easily compared to standard culture conditions. Thank you.
Okay, Olga, the next also to you. I did PGD5, had an embryo transfer, embryo transfer of embryo 5AA, but the embryo didn't implant. Do I need to do NGS next time?
Well, actually, there is not a lot of information about the current situation of this patient. I didn't know it because you didn't mention whether you have embryos frozen from this particular site. Was it a oocyte donation or it was your X case? But still, if you have embryos frozen from that cycle and they are of quite good quality, don't lose hope, because even euploid embryo with a very high quality not always implants into the uterus, because implantation also depends on mother, not only on embryos. So if you have embryos, you can go on for the next transfer and hope for the best. But if the embryos, well, actually we talk about one embryo, it was the only one embryo that you've got, probably that would be more informative to switch to NGS for the next cycle in order to get more information about genetics moments and genetical health of your embryos. And maybe it may serve as some kind of diagnostic procedure also to understand why implantation doesn't occur. But also, to be brief, one implantation failure cycle is not, I would say, condemnation. Still, you can get a good result with the next transfer, and I wish you this good result. Thank you.
Thank you, Olga. The next question from Beatrice, to my mind, it's a very popular question. Can a donor in the future find my baby and have any rights for the baby? Nadiia, please.
Thank you for this question. What I can say, as we understand, due to a law of anonymity in Ukraine, there is no legal possibility to have, for egg donor to have rights for the child. In clinic, egg donor has no data, no information about to whom this donor donates egg cells. A couple see egg donor only by number in a base. So we exclude the possibility of egg donor to know who is the where is her genetic material is, and again, due to Ukrainian legislation, egg donor doesn't have any rights for the child.
Okay, thank you. And another one, Nadiia, also to you. What if I can't choose the donor? Can you help me with it? Can you help me to choose?
Can we help? Again, we can propose you, for example, a Skype consultation with doctor. It is all, our doctor is always available to tell you about which features, for example, blood type will suit to your couple. Blood type of egg donor will suit to your couple case. Again, we can provide you maybe with additional information that will help you to make decision. Of course, we're open to help you. In any case, our doctors are open also. Thank you.
Okay, thank you. The next question I saw from Selena. I'm 40, want to try egg donation. If my donor is 25, do I need to do PGD? If PGD is needed, which one? Olga, please. I think it's for you.
Well, dear Selena, basically PGT is the technology that is used in clinics for some clinical indications, among them advanced maternal age, repeated implantation failure, spontaneous abortions in the history of a patient, and so on. So taking into consideration that donor of your future oocytes is a young woman, you don't have to go for PGT as a rule. But from the other point, you may use this test in order to select embryos for the first transfer to maximize chances with the first transfer, because PGT is not a method of treatment. You do not treat embryos, you just investigate them so you know whether they are healthy or not. And it means that if you go on for the subsequent transfers, of course, you will find such euploid embryos as well. But if you're opting for oocyte donation, you probably want to get the result as quickly as it possible. That is why PGT is often used in oocyte donation cycles in order to decrease time for pregnancy achievement and subsequently decrease your costs also. Thank you.
Okay. Thank you, Olga. The next question will be to Nadiia. If I choose economy egg donation program, can I do PGD?
Yes, it can be just like additional option. You can purchase the service of PGT testing. PGT5 chromosome testing cost is 550 euro, or you can choose PGT24 chromosome testing. The price for that is 2,200 euro for 10 embryos. Again, for additional embryos, you just pay extra 210 euro. Yes, it is possible. Thank you.
Thank you. The next question for doctor. I have low antimullerian hormone 0.7. I'm 33 years old. I want to try one more time. Does low IMG affects X quality? Thank you.
Вопрос к доктору. У меня низкий уровень АМГ 0,7. Мне 33 года, и я хотела бы попробовать еще раз. Влияет ли низкий АМГ на качество яйцеклеток?
Да, снижение антимюллеровского гормона ассоциирует и со снижением качества ооцитов.
Yes, the low levels of the AMH hormone also decreases the quality of the egg cells.
Но в возрасте до 40 лет это снижение не категоричное, поэтому имеет смысл попробовать свою стимуляцию. Все-таки 33 – это молодой возраст, который позволяет получить хорошие эмбрионы даже при сниженном антимюллеровском гормоне.
However, until you're 40, this decrease in the AMH level is not critical, and it's still possible to obtain healthy embryos. So you are 33, you're still young, so it makes perfect sense to try again to obtain the healthy embryo.
Спасибо.
Thank you.
Спасибо. Thank you. The next, I have a question for embryologist. How do you choose egg donor cells for vitrification? Do you freeze all eggs?
How do we choose donor eggs for vitrification? Strictly. Basically, according to recommendation of human reproduction societies, there are only two types of abnormalities of oocytes that really prove that these oocytes are not ones that can give healthy pregnancy. It's giant oocytes and oocytes with so-called aggregation of smooth endoplasmic reticulum. But in our laboratory, we select oocytes for freezing very strictly, and even moderate changes of zona pellucida thickness, pervitellin space size, granularity of cytoplasm that are not considered to be detrimental for clinical results still matter. That's what we select when we talk about donor oocytes, of course, not patients. We select only those oocytes that really do not have any flaws. They are totally perfect because we try to offer our patients best results. That's why even tiny chance that quality effects may influence is not possible. Thank you.
Thank you. The next two will be to Nadiia, and the first one, I'm trying to choose an IVF agency. Could you please help me to understand the difference between clinical agency and agency that work with the clinic?
Thank you for this question. The difference is quite clear. IVMED Family Agency was created by founders of IVMED Clinic, and we work and serve only for IVMED Clinic. If you will choose services, some programs in a medical center IVMED, our coordinators of the agency will serve you during this your treatment process. If to talk about difference, other agencies, they just can purchase services at medical center IVMED, and they can propose you different clinics. Our agency is more professional because we work with doctors, close with our doctors. We're completely aware of all processes. We react very fast. We are like a first in a chain. And I think that is quite important for your personal result in treatment. Thank you.
And the second one will be, dear Miss Nadiia, is accommodation far from the clinic?
I see. Thank you. The accommodation is not far from clinic, but anyway, it's not a matter of for you to be worried because we provide the transport. We have drivers, so they can take you from clinic to your apartment, from apartment to your clinic. We can assist you with a taxi. So it is included in the package. So don't worry, it is not so important. But it's not so far, it's not outside Kiev, it is quite close to clinic. Thank you.
Thank you for the answer. The next question to Olga. Do you have any special technique or technology for embryo selection for embryo transfer?
Well, to be honest, we don't have such a special technique because we look for the well-known recommendation of specialized societies, but still we take into consideration three important issues. The first is morphology of the embryo. So beautiful embryos often means ready to implant embryos. That's why we look for them. The second issue is genetical health of the embryo. Of course, if we performed PGT, then we should select embryo for the according to its result. And the third issue is time-lapse technology that gives us more information about particular stages of embryo development, and we can combine these three issues in order to select with the highest implantation potential from the cohort that you actually have. And as for me, it is also important we take into consideration our experience, because in our laboratory work a lot of experienced embryologists that have seen not only a lot of embryos, but also a lot of children born after their work. That's why we know embryos quite well, and it helps us to select better of them for the transfer. Thank you.
Thank you. Next question, it's for doctor. I'm 28 and I had 2 IVF cycles, but didn't receive mature oocyte. What will be the solution for my situation? Maybe I need to try another type of hormonal stimulation. Thank you for the answer.
Вопрос врачу. Мне 28, у меня было двое попыток ЭКО. Я не получила зрелых клеток. Какое будет решение для моей ситуации? Может быть,
Да, конечно. Для того, чтобы получить зрелые яйцеклетки, нужно рассматривать другой протокол. Для того, чтобы определиться, какой именно вам более показан.
So, in order to receive better results, it is best to consider another type of protocol of stimulation. There are different things that you need to consider before choosing another protocol.
Надо понимать уровни антимюллеровского гормона вашего, фолликула стимулирующего и уровень ЛГ, лютеинизирующего гормона.
So to determine this, it is best to know the levels of the AMH hormone, the LG results, and also the quality of the follicles.
Также важно проанализировать предыдущие протоколы, в которых не были получены зрелые oocytes.
It's also important to analyze the previous protocols where the mature oocytes were not received.
И тогда можно будет определиться с индивидуальным для вас протоколом стимуляции.
Only after this can we decide with the individual protocol of stimulation best suited for you.
Возможно, нужно будет удлинить количество дней стимуляции. Возможно, использовать другие препараты фолликулостимулирующего гормона для стимуляции, либо обсуждать двойной триггер. Спасибо.
So in this case, in your personal scenario, it could be the duration of the stimulation. Maybe you need more days to produce mature oocytes. It can be different medicines that could be used in the protocol of stimulation, or the double trigger can be used. Thank you.
Thank you for the answer. Спасибо. The next question will be to Nadiia. Good afternoon. Can I please ask if the economy frozen egg donation program is available if you are using SM?
Thank you. Actually, we have a range of surrogacy programs. We will perform a special webinar to talk about them. Actually, all programs, they divide into standard programs and guaranteed programs. Of course, if you want your individual package, it is also possible. We can offer you, for example, to start with IVF treatment. You will get embryos and then you will shift, you will move to surrogacy program. If you will have embryos, then you can plan, for example, the transfer to surrogate mother. So sure, you can contact us. We will give you information how it is possible to calculate and understand the total price for this package. But again, it is good option to make it step by step. First, IVF cycle, then transfer to surrogate mother. Thank you.
Thank you for the answer. And I thought that the two last will be to Olga. The first one, I had several IVF cycles with third day embryo transfer. What you prefer for embryo transfer, third or fifth day embryo?
The majority of embryologists prefer day 5 transfer because day 5 embryo forms so-called blastocyst, is a special structure, the main aim of which is to implant into the uterus. If embryo is not able to reach blastocyst stage, it means that it is not competent, is not promising, and for sure it won't implant. That's why prolonged culture till day 5 is a very efficient tool for good embryo selection. But from the other point of view, you also may go for day 3 transfer if you lack embryos, for example, have only 1 or 2 embryos, so you don't have to select any of them, except situations when you want to get more information, whether they able to form blastocysts at all. But if today we talk only about donation programs. So for oocyte donation, of course, it's better to do transfer on day 5. It is more efficient and it's more reliable technique. Thank you.
Okay, and the second one, do you have your own cryobank? How does it work during COVID-19?
Yes, we have our own cryobank, a very big cryobank, and basically for today it works as it's have been working for all the other viruses, because viruses surround us for plenty of years. They didn't appear these, and there's a lot of viruses that can be transmitted as a sexually transmitted diseases, and the whole procedure of embryo culture and vitrification is created in order to minimize the chance of disease transmission. So the same it works with SARS-CoV-2, and according to all the literature that we've got for today, there was no cases of virus spreading through cryobanks. So storage, freezing, storage, and subsequent sewing of embryos is quite a safe procedure, and we hope it will continue to be same for a COVID pandemic. Still, we may create safety procedures, and we will, but they may be introduced into clinical practice only when big randomized controlled trials and recommendations of special societies will be released, because some safety measures can really influence the results of the programs. So in order to be safe from SARS-CoV-2, we also have to be safe from result decreasing. So basically, yes, we have cryobank. It is safe to freeze and store embryos. And what else can I say? Let's be safe from this virus, as embryos at any cryobank in the world are. Please be healthy and take care of yourself. Thank you.
Thank you so much. It was the last question of our participants. So I want to say thank you to all our speakers for such interesting presentation and answers. Thank you for your time. And I want to announce next webinar. It will be dedicated to male infertility. So please join us, our webinar. And I want to say thank you for your time. Take care, stay at home, and see you next time. Thank you, all of you.
See you. Thank you.
See you.
Bye.